All right, let's talk about something that's frankly a huge deal for every single dog owner out there: canine heartworm disease. We're talking about a silent threat that grows inside our pets. It's devastating for sure, but here's the most important part: it is almost entirely preventable. So let's pull back the curtain on this unseen invader, see how it operates, and figure out exactly how we can stop it.
I mean, seriously, think about that for a second. What if one single mosquito bite could lead to a fatal disease? It sounds like the plot of a bad horror movie, doesn't it? This tiny, buzzing pest that we all just find annoying actually carrying a deadly secret. But this isn't fiction. For our dogs, this is a very, very real danger lurking just about everywhere.
And for millions of dogs, this isn't a what if, it's a reality. And the threat is so much closer than you probably think. It doesn't matter if you're in a big city, out in the country, up in the mountains, the mosquito, the carrier of this disease, is basically everywhere. This isn't some regional issue anymore. It's a global one.
So, just how widespread are we talking? Well, when you look at the data, it paints a pretty concerning picture. We're seeing a parasite that is constantly on the move, expanding its territory in ways that are actually kind of surprising.
Yeah, this problem is not limited to one little corner of the world. You can see how common it is all across Europe. And then there's this jaw-dropping fact: heartworm has now been diagnosed in all 50 US states, every single one. Things like climate change and even just people moving and taking their infected pets with them mean that no area can really be considered 100% safe anymore. And here's one of the main reasons that threat keeps growing. What you're looking at is something called an urban heat island. Basically, cities, with all that concrete and pavement, soak up and hold onto heat. This creates these little microclimates where mosquitoes can survive and thrive for much longer, even when it gets colder. It stretches out what we used to think of as mosquito season into something that's practically year-round in some places.
Now, to really understand the danger here, we need to go undercover. We need to follow this parasite on its incredible and incredibly destructive journey. It's like a secret invasion that happens entirely out of sight, deep inside a dog's body.
And it all starts right here. The whole life cycle is this complex dance between two different hosts. So an infected dog has these tiny microscopic baby worms called microfilaria swimming in its blood. A mosquito comes along, bites that dog, and sucks up some of that blood. That mosquito then basically becomes a living incubator. And inside it, those baby worms develop into infective larvae. Then, that same mosquito flies over and bites another dog. But here's a wild detail: the larvae aren't injected directly into the dog's bloodstream. Instead, the mosquito basically leaves a little puddle of fluid on the dog's skin, and the larvae swim out of the mosquito's mouthparts and into that puddle. Then they crawl into the tiny bite wound. That's it. That's the moment of infection. And once they're inside, the secret invasion really kicks into gear. For months, these larvae are migrating and changing, molting under the skin. They travel through the dog's tissues, eventually becoming immature adults that find their way into the bloodstream. Around 3 to 4 months after that initial bite, they finally arrive in the pulmonary arteries around the heart. And here's the really scary part: during this entire 6 to 7 month period, the dog will show zero signs of being sick, and any standard heartworm test will come back negative. It's a completely silent takeover.
Okay, so after all those months of quiet development, the worms are now adults. And this is when they start to take a devastating physical toll. This is where the disease gets its name and where the real damage finally begins.
When the symptoms finally show up, they can be super subtle at first. You might just notice things like a light cough that just won't go away, or maybe your dog gets tired really easily after a little bit of playing. They might not seem as interested in their food, but by the time you're seeing these signs, the damage on the inside is already well underway. So what is actually happening in there to cause all this? What are these invaders doing to a dog's heart and lungs to make them act this way?
This is the reality. Those tiny larvae that arrived months ago have now grown into massive adult worms. Some of them can get up to a foot long. A foot. They live in the pulmonary arteries and the right side of the heart, and they just cause chaos. Inflammation, scarring, and literally clogging everything up. I mean, imagine a bunch of spaghetti noodles jamming up the most important pipes in your house. That's what's happening. And it leads to severe lung disease, heart failure, and damage to other organs too.
So if this whole thing happens in secret, how in the world do you find these invaders? Well, veterinarians have some very specific tools to detect an infection that's completely invisible from the outside.
Your vet is going to use two main types of blood tests. There's an antigen test, which looks for adult female worms, and a microfilaria test, which looks for the baby worms. Now, figuring out what the results mean can be a little tricky. For example, a dog can definitely have adult worms but test negative for the baby ones. That's exactly why annual testing is so critical to get the full picture of what's going on.
Okay, so what if a dog does get diagnosed with heartworm? Well, the path to recovery, it's not simple. It is a long, expensive, and risky process that is incredibly tough on both the dog and their owner. The standard treatment that's recommended by the American Heartworm Society takes months to complete. It starts with pre-treatment using antibiotics, then it moves on to a series of really painful injections of a drug that's actually arsenic-based to kill those adult worms. But the most critical, and I mean the most critical part, is the strict exercise restriction. See, as the adult worms die, they start to break apart, and those pieces can cause deadly blood clots in the lungs. Any kind of exertion dramatically increases that risk. Okay, that was a lot. It's intense, it's scary, it's expensive. Now, after hearing all that, let's talk about the alternative, the simple, powerful tool that makes all of that completely unnecessary. Instead of all of that, the months of injections, the risk, the confinement, you have this. One simple dose, once a month. The contrast is it's staggering. It's night and day. And there are plenty of FDA-approved options out there. They come in all different forms. Chewable tablets, stuff you put on their skin, or even injections. Now, the genius of these preventatives is that they don't kill the adult worms. Instead, what they do is safely and effectively wipe out any of the little larvae that were transmitted by mosquitoes in the past 30 days. It stops the entire invasion before it can even get started. And look, don't just take my word for it. The expert consensus on this is crystal clear. The American Heartworm Society, the absolute authority on this stuff, officially recommends giving these preventatives year-round, no breaks. Given everything we know about urban heat islands and unpredictable weather, there's no such thing as a safe season anymore. Consistency is absolutely everything. So, when you just lay it all out like this, side by side, the choice is it's a no-brainer, right? On one side, you have a costly, painful, high-risk ordeal. And on the other, you have a simple, safe preventative that just lets your dog live a normal, happy, healthy life. At the end of the day, it really all comes down to this one question. This unseen invader is a formidable enemy for sure, but it's an enemy that we have the power to defeat with one simple action every single month. Your dog's health and their heart, it's in your hands.